Hello everyone, I am Dr. Shilpa Saple, Fertility Consultant. Today I will be talking to you about IUI, that is Intrauterine Insemination. So what is Intrauterine Insemination? This is the placement of washed motile sperms into the uterine cavity. As you can see in this diagram, that the sperms are placed inside the uterine cavity. So when is this procedure done? Like what are the indications? So first and foremost, any issues with the sperm count or motility, that means a subnormal sperm sample. In those cases, with an IUI procedure, good motile sperms can be sought and placed into the cavity at the time of ovulation. Secondly, if there is any issue with normal intercourse between a husband and a wife, and it's not possible to conceive due to these issues, or if the wife has vaginismus or any pathology like cervical or vaginal infections or lesions. Thirdly, the use of donor sample. Now, a donor sperm sample may be indicated wherein there is azoospermia or no sperms in the husband's semen, and they will not be willing for any surgical method of getting the sperms. Other cases like genetic problems associated with the male partner, which may be transmitted to the child. So in these conditions also a donor sample may be indicated. Now, when should an IUI be done? So this is typically done at the time of wife's ovulation. It can also be done once the HCG trigger is given for ovulation. Now let us look at the procedure of an IUI. So after signing the consent and confirming the identity, husband is asked to give sperm sample by masturbation. The sperm sample is collected in a sterile container. This is then kept for liquefaction, and then semen preparation is done. So this is the centrifuge or the spermfuge in which the sperms are mixed with a certain media and good motile sperms are obtained. These sperms are then taken into a fine catheter, and the insemination of this sample is done into the uterus vaginally. After this procedure, wife is asked to wait for about 10 minutes in the same position, and after that she can continue with her normal activities. This is an absolutely painless procedure, and there is no bed rest required at any point of time. For this procedure, some medications may be given to increase the number of eggs. That is, a stimulation of ovary can be done with the use of tablets or injections, and accordingly this treatment can be planned. For patients who this timing and the preparation is done in a proper way, there are very good chances of conceiving. Generally, about 4 cycles of IUI can be tried before going for higher forms of treatment. So, we wish you all luck, and for those who are wishing to conceive, all the best. Thank you.